Hello, I'm Dr. Dennis McKenna, joined as always by Dr. Fred Venditti, our hospital system general director. Today is Thursday, October 29th, giving you the update from Albany Med. All right, Fred, let's jump into the first graph. These are the 8 counties of the capital region. You can see on that graph now we have 80 people currently admitted to hospitals in those hospitals with COVID. We're going to talk in a couple minutes about a press conference we had yesterday where we'll address those numbers. So we'll come back to that in a second. Next graph here is admissions and discharges from Albany Medical Center. Yesterday, good news, we discharged 5 people from the hospital with COVID and didn't admit any. And so that makes our numbers this morning 14 in the hospital. Breakdown there, Fred, is 8 on the floor, 6 in the ICU, and currently 1 on a ventilator.
That's right, Dennis.
Right. Now on that third graph, the one I just showed, in the future going forward, we're also going to be showing flu activity on the same graph. We don't have anybody in the hospital currently with
That's
flu.
right. That's good.
And we're going to talk about flu in a bit as well. So Fred, I mentioned this yesterday. We had a press conference here at Albany Medical Center. We were joined by leaders from many hospitals in the region. We had, I think, 3 or 4 of them back in the beginning of the pandemic, but we had not had one in almost 6 months.
It was back in April.
It's back in April.
Yeah.
A lot has changed since April, and we went over all the things that had changed as far as testing, as far as prevention, as far as therapeutics. What was your takeaway from the meeting yesterday?
Dennis, I thought it was really good. I thought we brought the community up to speed on what's happened.
Yes.
So we had that big peak, very rapid. It's come down, and now it's slowly starting to go back up.
Right.
But we also talked about some of the things that we're doing to prevent it from going up as high as it was back in the spring. And we also talked about the flu.
We did talk about that.
This is flu season coming at us.
Let's pick up that in a second. One of the things, Fred, that you talked about was COVID fatigue. This is a term that a lot of people are referring to, and I think it's an important message. And what we said yesterday is our message is one of resilience, not fatigue.
That's right.
One of cooperation, not competition, and it's one of preparedness, not fear. And these are important messages to get out not only to our workforce, but the community, that says that if the numbers continue to go up, we have a plan. We've already executed on that plan in the past, and we would be happy to do the same things again if we had to.
And Dennis, you know, we had represented there 6 institutions from around the region.
Right.
We continue to talk every Wednesday morning amongst 12 institutions. Right. We continue to share information. We will share both clinical protocols and other important aspects of dealing with COVID as we go forward. We're going to act like a regional system.
Which is absolutely incredible. And again, I thought it was a great press conference. Now, one of the things you mentioned, Fred, is that we also talked about the importance of getting a flu vaccine. And again, why don't you pick up on that and tell us a little bit about that? Sure,
Dennis. So we're entering the flu season. Back in the spring, flu was almost gone by the time COVID hit.
Right.
So we didn't have to deal with essentially 2 illnesses that can present looking very similar. So it's really important that the community out there get vaccinated. Mm-hmm. If that's a significant number of people, perhaps we'll have a very light flu season. Mm-hmm. So if COVID does start to surge, as we expect it might, we won't have to sort out, what's really going on with those patients. So flu vaccine, it's available. It's not 100%, but it does mitigate the symptoms if it doesn't prevent the flu. We're actually mandating flu for our employees.
Started last year.
And guess what? A number of the other hospitals in our region are doing the same thing. That means 35,000 healthcare workers are going to be vaccinated probably by the end of November. It's a large number. It sets an example for the community. It starts us down the right path. And most importantly, Dennis, it underscores what we've been saying here: healthcare is safe for you. We're focusing on the safety not only of our employees, but the patients we treat by doing the vaccinations we're going to be doing.
It's a great point. And as we wait for the COVID vaccine to come through trials and hopefully be produced and distributed, today you can go get your flu vaccine. So that's our public service announcement today.
Absolutely.
Go
get your vaccine.
Get your vaccine. All right. So we talk about being safe against COVID or influenza. We also want to keep our computers safe, right? So cyber attack is a real thing. And in point of fact, there's some activity in this area nationally today.
So Dennis, we heard today, and this has been coming from multiple sources, that there's a cyber attack going on. It's a ransomware attack specifically targeting healthcare institutions. Mm-hmm. 6 institutions have been breached nationally. They think it's coming out of Russia. One has actually been breached in New York State, the St. Lawrence healthcare system up in the northern part of the Adirondacks. So we just want to emphasize for our staff how to be safe here. We have things in place to prevent ransomware from coming in, but if you get an email or a telephone call from someone you don't recognize, don't open an attachment, don't click on a link, and definitely don't give out your credentials,
Never.
your username and password, even if the individual tells you they're from our help desk, because you know why? Our help desk would never ask
They would never ask
give
you that.
the credentials to them.
That's correct.
So it's really, really important.
It's especially important given the fact that we have so many members of our workforce working from home, remotely,
Yes.
connected to the organization through their laptop computers. And a quick shout out to Chris Couchet, who really leads our cybersecurity efforts here. He's remarkable when it comes to this sort of
We
stuff.
have a great firewall for preventing some of this, but sometimes some of it gets through, so be vigilant.
Yeah. If you have any questions, don't click, call the help desk,
That's
ask for questions. Fred, specifically for our employees, we wanted to talk a little bit about CDPHP and some of the offerings and something related to called Find a Doc. Find a Doc.
That's right, Dennis. So we have some special characteristics of our health plan if our employees use either the physicians that are part of the Albany Med Health System or the domestic network, which includes some of our affiliates. So CDPHP on their Find a Doc website has created a way for you to actually see who those two sets of physicians are, and they do overlap.
Great.
So you go to the Find a Doc site on CDPHP, click on Albany Medical Center as your employer, and you'll be able to search both our system physicians as well as our domestic network.
Awesome. All
Preferred
right.
providers.
Good. All right. A great service from CDPHP. Lastly, Fred, we're going to get some shout outs this week to a couple members of our workforce groups who provide incredible, important services here all the time. So I'll go first. It's Pastoral Care Week. We're very proud of the work of our pastoral care program. In fact, we have a fellowship for people who want to come and do that type of work. And they're led by the very capable, I love to call him Captain Marvel, Jake Marvel, who's also in the military. And we're very proud of the work of our pastoral care people.
You know, Dennis, my mom died in the hospital a couple of years back, and I remember the pastoral care folks coming in. It was very comforting to the whole family.
I have a similar experience with my father, and I know working in the emergency department, they're always down there. They really are incredible. 24/7 they're available here at Albany Med. Respiratory
Therapy Week. Obviously, the respiratory therapists are incredibly important, particularly in our critical care units, and particularly in dealing, obviously, with respiratory illnesses as we're moving into respiratory season. So shout out to Maureen Dixon, our supervisor, and all the staff in respiratory therapy.
And as we talked about in the beginning of the pandemic, they re-engineered their work. We were moving ventilators outside of rooms. They were very involved in that to make sure we cut down on traffic in and out so we could provide safe care, but really critical care to these patients.
They're fantastic.
So the last group is our facilities and engineering team. So I'll name one, you can do the other. Obviously, we talked about all the work they do here on this campus. And again, since we often talk about COVID, they created negative pressure rooms for us. They created testing locations for us. They do so many things as far as keeping this massive building up and running. So Emilio Genzano, thank you very much.
And Briggs Montero, thank you very much.
Yeah. And their whole teams.
And their whole teams.
For sure.
Absolutely.
All right. Well, we love being able to do those shout outs. I'm sure we'll have a bunch more next week as well.
We will.
All right, we're heading into the weekend. It's going to get cold. It might snow. Do not stick your hand in any snow blowers. That's always a message we like to deliver this time of year. Careful shoveling. And we'll see what the weekend brings us. And we'll be back again next week on Tuesday.
Yes.
All right, very good. We ask that you once again please take care of yourself, take care of each other, and we'll see you next week.